Hi, I'm Tony, physical therapist at Lima Memorial. If you're watching this video, you've been scheduled for heart surgery at Lima Memorial. We're here to support you through every step of your surgery experience and prepare you for the work of recovery. If you've ever had a loved one undergo heart surgery, you may already be familiar with the importance of moving safely after surgery. The goal of this video is to give you a better understanding how to move safely following your surgery, allowing you to recover better and get back to your normal life sooner. After surgery, you will follow precautions aimed at preventing complications and promoting healing of your incision and breastbone, or sternum. In this video, we will introduce you to a proven method that, when followed correctly, will improve your safety, healing, and mobility. This method is called Keep Your Move in a Tube. Picture a tube around your body. As long as your arms stay within this tube, you're able to do nearly any movement that is comfortable for you. It is still crucial that you listen to your body. If you're experiencing an increase in pain during any activity or movement, stop immediately and talk to your healthcare team about what you're experiencing. During any activities that are load-bearing or involve pushing or pulling, you'll keep your elbows and your upper arms next to your body and within that imaginary tube. Examples include pushing open a door, carrying something with your hand. If the activity you're doing does not require any force from your hands or your arms, you're free to move outside that tube. Now that you have a good understanding of the keep the move in your tube concept, let's look at how to follow these guidelines while getting up from a seated position. This includes standing from a surface you're sitting on. As we previously discussed, the first thing to consider is where your arms and elbows are in relation to your body. When attempting to stand, you never want to push from the armrest of the chair. Instead, put your hands on your legs or on the surface that you're sitting on. This will prevent your elbows from moving outside of the tube. Using your hands for balance and support, first scoot to the edge of the chair until your feet are flat on the floor. Then, lean forward to get your nose over your toes and slowly stand up. Once standing, pause for a few seconds to make sure you're not dizzy. If you're using a walker, you can place your hands on the walker after you are balanced. It is also important that your walker is set to an appropriate height, which will allow you to balance while keeping your arms inside the tube. Now, let's talk about how to safely get in and out of bed. While laying on your back, you will first bend your knees up. You will also want to have your hands beside you or in front of you and across your chest. Use slow, controlled rocking to help you roll onto your side. Once you're laying on your side, you will bring your legs off the bed while using the top arm to push across your body and push yourself up to a sitting position. It is very important to not use your bottom arm and elbow because this will force your arm to move away from your body and outside the imaginary tube. Once you get to a sitting position, keep your arms to your sides, place your hands on the bed or on top of your legs, and scoot to the edge until your feet are flat on the floor. You will want to sit in this position for a few seconds to ensure you are not dizzy before you continue to a standing position. Sneezing and coughing are activities that cause the most strain on the chest and sternum. For these activities, you'll want to hug your chest to help protect the incision and surgical site. By doing so, you can decrease the amount of force and pain created by the sneeze and cough. The Keep Your Move in the Tube precautions start immediately after surgery and will continue for up to 12 weeks. Please be prepared to discuss these ideas with your doctor throughout your plan of care and during your follow-up appointments. We also encourage you to begin using these techniques during the days leading up to the surgery. This practice will make it much easier for you following surgery and during the recovery phase. Following surgery, being active and mobile will be critical for your recovery. You will walk with the assistance of a care team member at least 3 times every day. Physical therapy and occupational therapy will evaluate you and help you by promoting activity, teaching you exercises, and providing equipment recommendations for your safety. The therapist will also help determine discharge recommendations with the goal of getting you back home as soon as possible. Thank you for taking the time to learn about safe movement after heart surgery. I hope you have a better understanding of keeping your move in a tube, and know that we're here to guide you and answer your questions. At Lima Memorial, we are committed to offering our patients the latest care techniques to shorten recovery times, restore independence, and most importantly, get back to your normal life. If you have any questions, please reach out to your doctor or a member of your care team, and we'll be glad to assist you.